Hey, it's Steph, and welcome to the Straight Up with Steph podcast, where we have real discussions around health and life and just trying to be better at both. Hello, and welcome back to another episode of Straight Up with Steph. I am so excited to tell you that we have the amazing Brush with Britt on the podcast today. She's not only one of my best friends, but also creator of Brush with Britt. She's a podcast host, content creator, she speaks, she writes, she kind of does it all. She's created such an impact in our industry in a relatively short amount of time, and I cannot wait for you to get to know her a little bit better. Today, we're going to talk about her history in dentistry and how she became a dental hygienist. We're also going to talk about attending dental conferences today and something that actually happens after the conference that not many people talk about. She attended two really big conferences in July, and one of them she won a big award at, which we'll talk about too. We touch on what it's like to be on social media, to be out there creating content, and some misconceptions that people might have for people who are out there creating. Stay tuned for this fun conversation with me and my bestie, Britt. Hey, Britt.
Hi, Steph.
It's so funny, like, that you're on the podcast, but we've already been talking a bunch this morning.
I know. It's like normal, regular conversation on Marco.
I know. But now, like, people get to listen to it, so that's cool. How's your Saturday going?
Saturday's going good. I got a good workout in.
What'd you do for your workout?
For my workout, I did my Les Mills like body pump class. So it's like the weightlifting one. So it was good.
Yeah. That's the one where you're doing like 5 million reps and it's relatively lightweight, right?
Yeah, you do quite a bit of reps, and then it does like full body. Like you start with like your bigger muscle groups, and then you go through like triceps, biceps, and all that kind of stuff, and then you end with like stretching. So it does do a full body, but yeah, it's a lot of reps.
Yeah, I remember. So I did that a long time ago, like a long time ago. And I really liked it, but I remember that there would be like, these bros that would come in and they would like grab the heaviest weight that they could, and literally they'd have to set it down after like a few minutes. It was pretty funny.
Yeah.
And then grab the little like dinky ones.
And I have no shame now. Like I grab the lightweights all the time because I just know like I'm not going to be able to use a big weight the whole time. But yeah, definitely when I see people grab some big ones, I'm like, oh, you're probably going to need some small ones after that.
I know, it's funny. And I learned that too, because I took a break from like lifting when my back was really bad, and I started doing yoga, and then I wanted to do it was called, what was it called? It was at Core Power, and it was something where they incorporate weights. I can't remember the name of the class, but I grabbed, because I'm used to lifting relatively heavy, and so I grabbed like 15, 20-pound dumbbells and brought them in, and like these chicks were just looking at me, probably like how I used to look at those guys. And there's no way I could do it. I'm like, can I get a 2-pound set? Like, this is too heavy.
I know. And I am really focused too on my form now too. So I'm not worried about like trying to lift this heavy weight. I would rather my form be perfect and me not swinging a weight around than doing a heavy weight just to do a heavy weight.
Right. Just to like use your momentum to like supposedly lift it when you're not actually lifting it. Yeah, that's really good.
Yeah. Yeah.
So I was thinking when I was just like getting ready for this podcast, because I feel like we've been friends for longer than we actually have. But how did we meet?
We met at Evolution that one night when you came in your workout clothes.
Talk about no shame. I'm like, I'm tired. No, but we had started talking because that's where we met in person.
Oh yeah.
But
Yeah.
we started talking before that. Did I reach out to you on social media?
Yeah, through Instagram.
Okay. And I remember because I haven't been doing like content creation really for that long. And I remember I was pretty new back then. And I remember seeing something, and I didn't know anyone. I had no idea what I was doing. And I remember I was like, well, Brush with Britt, I keep seeing like her posts pop up. And then I asked you a question, and I just remember, I can't even remember what the question was, but I remember your response was so friendly and like welcoming and enthusiastic. And I don't know why I didn't expect that, but I didn't. And I was just like, oh, like this chick's actually pretty cool. And then I just remember we kind of hit it off. And then, of course, we met in person, and that was great too.
Yeah, I think I remember asking you something about my thumb pain.
Oh,
And you're like, well, you
Oh,
kind of
that's
need an
funny.
assessment. And I'm like, oh, yeah, that makes sense. I do. And then I figured out that I was wearing like really small gloves and it was like restricting, it was making my thumb kind of like flex inward. And then eventually I figured that one out. But I feel like it was just cool to talk to you about like ergonomics. And then eventually I asked you to be on my podcast. And I think from there we just kept on talking.
Yeah, yeah. And I remember too, like meeting you in person, and this is another thing too I didn't expect is like at least with you, and there's other people like this too, but when I meet them in person, it's like their person in person is the same as who I met online. And sometimes that is the case and sometimes it's not. Like you have a certain image of meeting someone in your head in person and you meet them and they are not at all like they perceive or portray themselves online. And I just really admired that about you. I was like, wow, she is really genuine, and I
Yeah.
mean, you still are. You're one of my best friends.
Hey, same to you, girl. I'll never forget
So
you walking in and like we were the same height and I was like, yes.
I know that is nice. And that's another thing too, meeting people in person. A lot of times they're way shorter than I think they are. And I'm just like, am I a
Are we
giant
taller
or like
too?
what? I know. I know. It is nice meeting someone who's tall. Like we can actually take good pictures together and stuff. So you've been when did you graduate? Like when did you go and then graduate hygiene school?
So I started my prereqs in like 2016 and then got finished with those in 2018-ish and applied to dental hygiene school and ended up starting dental hygiene school in 2018 and then graduated 2020.
Pandemic, eh?
Hmm. Great
How
year
was
to
that?
graduate.
Yeah,
Awful.
I just remember like looking at people's posts and stuff during that time, and I was just like, "Oh my God, I cannot imagine being in school right now."
Yeah, I mean, there was a lot of hard things about it, but it also gave me some really good different perspectives that I didn't have and I wouldn't have had I not gone through that. So I'm thankful for that.
Yeah, yeah. I mean, it's good. Like you do learn like life lessons in situations like that, but I just remember hygiene school for me, it was stressful enough. I mean, that might have just literally pushed me over the edge. I don't know.
It was crazy when we went back to clinic. It literally, I don't know if you've seen ET, but there's like that scene where they're like going through everything is all covered up in like white and they're like going through like a tunnel. It's like towards the end of the movie. I forget like what is happening, but I think they're like they're trying to get ET or something. But that is what our clinic was like. Like we had every little corner had like they weren't shower curtains, but it was basically like the whole thing was like a big shower curtain. It was so weird to take patients into that.
Oh my God. You're like, I promise you're gonna be fine.
Yeah.
I promise this is okay. Yeah. But you were an assistant before that, right? How long were you a dental assistant for?
So I started assisting in 2013 and I did that throughout my prereqs and the hygiene program. So I was a registered dental assistant for 8 years.
Wow. And in California, because that's where you're at, to be a dental assistant, do you have to be certified or can you get like on the job type training?
So you could be a DA or RDA, so dental assistant or registered dental assistant. And to be an RDA, like you have to take like a board exam and stuff like that. And then I don't know if things have changed. It's obviously been a while since I went through that process, but I think there are different routes that you can take to becoming a dental assistant that like may not require as much schooling to become like an RDA, but it kind of varies. I feel like there's different paths.
Yeah. Well, even, I mean, it varies probably within the state. It varies state to state. Like it's just all over the place. I know here, our Practice Act really for hygienists and dental assistants is very progressive. And dental assistants can do a lot. I mean, they can pretty much do anything except for like prepping the teeth or like extracting teeth. They can do a lot.
Yeah, we also
Um,
have RDA EF. So it's like
yeah.
extended functions, and they can do, like you were saying, pretty much everything except prep the tooth. Pretty
And
awesome.
here, I don't know if it's changed. So hopefully I don't get blowback if this is wrong. But at least when I moved here, dental assistants could become expanded functions like on the job. Like they didn't need any kind of school or like certification or anything like that. And I think that can, that can be good and bad because I've worked with some assistants that they literally did better fillings than any dentist I've ever seen, like they could really kill it. But then there's some that didn't really have a whole lot of training and they were out there calling themselves an ETA and they weren't. So, it just depends on how you look at it, I guess.
Yeah.
So that's kind of cool. You saw things from like both sides. Because when I went to hygiene school, I had no dental experience at all. Like I barely knew what a hygienist did, honestly.
And I try to get that perspective, and I was just an assistant for so long that like I have no idea what it's like becoming a hygienist without any dental experience. Like that to me, assisting gave me such a good solid background and like foundation in dentistry, but still at the same time I knew nothing about dental hygiene. Like I had this perspective that I knew what dental hygienists do, and I thought that is a piece of cake. I can do that. That's so easy, but I had no clue. And you don't understand until you're in it and doing it. But even being an assistant for that long, I still didn't fully have an understanding of what hygienists do. And
Yeah.
I feel like
Well,
it goes vice versa too. Like someone who's a hygienist who has no experience in dentistry has no idea what it's like to be a dental assistant.
yeah, it's true. And I never I do not pretend to know what it's like to be a dental assistant. I know I've tried assisting chairside, and the doctor literally was like, "This would be better if you weren't here." Like if I was by myself, I'm like, yeah. But yeah, I mean, it's the same with us, so as an assistant, did you think that hygienists were divas?
So most of the offices I worked in actually didn't have hygienists. So
Oh,
I would assist the doctor in doing the cleanings, and then as an RDA, I could polish and stuff like that. So they would do the Cavitron and all of that. So I really didn't know the majority of what hygienists do, and the experience that I had with the very first hygienist I worked with was not a good one. So I
yeah.
did kind of feel like, I don't know, like you're kind of bratty.
Yeah.
But that then from there, I really just worked at private practices that didn't have a hygienist. And so, seeing the doctors do these cleanings and experiencing things like never seeing them pick up a hand instrument and then getting into dental hygiene school. And I'm like, what? I'm like, what is a posterior this and an anterior that? I'm like, I never saw them pick that up. I'm like, I literally just saw an ultrasonic and then I would go in and polish. So it was
Wow.
a whole new world for me.
Yeah, it's crazy. I mean, that's a whole nother conversation, I guess,
Oh yeah.
dentists cleaning teeth, right? Like we don't have to get into that, but but I did want to talk about some stuff that's happened with you lately. You've gone to two really big conferences last month in July. And you got a huge award also, which by the way, I'm just so proud of you for getting that. That's huge. But I just wanted to hear about let's talk about the first conference, the one in Korea where you got your award.
So the one in Korea, that was the ISDH, which is the International Symposium on Dental Hygiene. And that one is a international conference that moves around every 2 years, and it's for hygienists globally to attend. So that conference I had heard about from other hygienists that I talked to that had gone to it before, and like regardless if I received the award or not, I wanted to go to that conference because I had people just tell me that this conference is like life changing, career changing, and it'll open your eyes to so much more. So I initially already wanted to go. And so then receiving the award, I mean, it was the perfect opportunity to get to attend. And it was just pretty incredible to see hygienists from all over the world. Like that part is just really eye opening to how much we can do and have done in our profession and how much work we have to continue to do. But it was really cool to collaborate on a like global level.
And getting the award too, was that just something that like you applied for or like what can anyone apply for that award? How does that work?
So that award was the World Hygienist Award, and I specifically won the new RDH category. So there's 6 different categories. It's like public health, academia, and there's a few other ones. And you have to receive the award of distinction in the United States first in order to qualify for the World Hygienist Award. So in 2023, I received the award of distinction for, again, the new RDH category. And then I was able to apply for the World Hygienist Award. So I had to make a video, and also there's like a panel of people that like are judges, and they decide who they think who the recipient should be. And then you have to like answer on like some questions and stuff and send it in written form. And so they basically decide who they think should receive the award.
So I remember watching that video and of course voting for you, but was it a huge shock when you got it? Like, were you super stoked? What was it like getting it? Like, cause you had to get on stage and like talk in front of people, right?
Yeah. So, I was up against one other person, and I knew with all of the things and the work that I've put in, I might have a pretty good chance. But still, you never know. But I was really excited, and it felt like my hard work is being recognized when I received the award. Like initially receiving the email, but then yeah, we had to go on stage and answer a few questions. And that part, I mean, of course, my anxiety went through the freaking roof. And I did feel like I was going to pass out just because I'm like, oh, I hope I like say the right thing, because I rehearsed my answers to the questions, but still, like, you don't want to like stumble on your words. And we had like a time limit, so I didn't want to go over the time and stuff. But that was definitely cool to see a room full of people like excited to see you receive the award, and also to hear your answers to the questions too.
That's awesome. Yeah, I feel like in a situation like that, because I'm kind of used to talking in front of people, but not for something like that, where you almost feel like you're representing more people than yourself. And then it's like, oh my God, like, what if I say the wrong thing? Like, what if
Yeah.
someone, doesn't agree with what I'm saying? Like, it's kind of a lot of pressure. But I'm sure
Yeah.
I mean, I've seen you speak and, you'll come later and be like that you were nervous or something, but you don't show it, and even in that video when you were up there talking, like you just seemed like a natural up there.
Yeah, because I definitely did and do feel that pressure of representing new hygienists and what we're capable of doing. And I want to do that in a way that also like inspires new hygienists, like, wow, to strive for something. So I definitely didn't want to like stumble on my feet.
Yeah, no, I mean, I wasn't there. I saw it on your Instagram live, but I think you did great. But
Mm.
another thing with those conferences, and so you had that one, and then we went to RDH Under One Roof just like I don't know, a few weeks ago. Um, and with those conferences, like they're exciting, like you're meeting new people, especially if you're meeting people from out of this country. You have all these classes and walking the floor and seeing new products, all this. It's really exciting, really stimulating. But there's something that happens after these big conferences that I feel like people don't talk about a whole lot. And I wanted to talk about that with you because we have discussed this before, where it's almost like when you're done with the conference, you almost get depressed. I mean, it's not something that, sticks around for a whole long time, which is good. But I remember the first time that happened to me, and I thought there was something wrong with me. But then I found out this is kind of like a natural thing that people go through. But can you say that like you've experienced that too?
Yeah, so I mean, definitely us having our conversations and talking on Marco about this, like, I mean, I was venting to you, just expressing how I was feeling after both of those conferences, and going back to my clinical work, and, just sharing with you that, like, I just feel, it's so weird to, for people listening, it's a very weird feeling to receive like such a prestigious award. And it's not that like I'm ungrateful for it or I don't appreciate it or anything like that. But it's just like when I came back, it was just like, whoa, like I'm almost like I'm like back to, I don't know, I guess reality, but at the same time, I feel like it's just such a high when you're like going around meeting all these people, talking, taking pictures and going to classes, and it's like boom, 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 boom. And then you get home and you're still, you know, faced with the same things that you were when you left. I don't know. It's such a weird thing to explain, but I definitely have felt that. And I didn't recognize what it was until you said that to me. And you were, what was the term that you used? Post conference. What was it?
Like post-conference depression.
Yeah.
Yeah. And it's something that I learned about, and I listened to, you know this, but I listened to the Lab podcast religiously. And he talks a lot about dopamine. And when we are, and dopamine isn't something that we get when we, like work out, or for people who drink when they drink, or take a drug or whatever. I mean, yes, we do get dopamine in those situations, but we also get dopamine in the anticipation of something. And so when we know that we have a conference, or someone who's prepping for a marathon, or someone who's trying to get a graduate degree or whatever, when we're prepping for that and preparing for that, we're getting hits of dopamine that keep us going to achieve that goal. And then we achieve the goal, and then it's like, oh, like that's it. And you kind of lose your purpose, you lose your focus, you feel like you don't have anything left. And then that dopamine tanks and you feel like shit for a while. So it's kind of the same. It's definitely the same thing with conferences, and we get so stimulated there. I mean, this RDH under one roof for me was the craziest experience I've had at a conference, with getting stopped, taking pictures, talking to people. It would take 20 minutes just to walk to the bathroom sometimes. You know, it's a lot, and it's cool meeting people. But it's also very tiring. And then you kind of get home and you're completely exhausted, you know?
Yeah, and I think too, you know, with receiving the awards and stuff, you know, you mentioned it to me where you said like of course getting the award um is incredible, but you get a lot of like that build going through the journey of getting there. And so, you know, receiving the award, being on stage and getting it, and then going home and being back to clinical work, it just made me kind of reflect on like, wow, you know, it was really about the build up getting there. Um, Rather than just holding the award like in my hand by itself, if that makes any sense.
Yeah, it's like it's about the effort that you're putting in to get something. Like that's where we get the most fulfillment. It's not getting the degree. You know, I was talking with my boyfriend on our walk today, and it's like if someone's pursuing a doctorate degree, you know, we know hygienists who have gotten their doctorate degree, which is crazy, but you're pursuing an advanced degree, and you have these expectations of what you think your life will be like after you get that degree, you know, and usually it's like really inflated. And then you'll get the degree, and then you realize, at least at that time, nothing has changed in your life. And so having this crazy expectation of what your life is going to be like after, and then realizing I still have to come home and clean the toilet, you know, I still have to clean
Yeah.
out the cat box. Like this is my life. And it can be somewhat of a letdown, you know. But I don't think a lot of people realize that when they get done with conferences and maybe don't feel well, and that a lot of us feel that way, and it's okay. Like there's no shame in it, and you do get back to normal. You just need to let your brain like regulate a little bit after.
Yeah, and I've really struggled with, and I'm starting to recognize my pattern, and I'm trying to get better with it. But I have, once I started on my journey to becoming a hygienist and really like turn my life around, really, I have always just been like, okay, the next thing, the next thing. What do I want to do next? You know, get your associates, get your bachelor's, get your RDHAP, get the award of distinction, get the World Hygienist Award. And then it's like, boom, okay, you got that. Now what are you going to do? And so it's like coming home to that and just being like, dang, I just did all these things, but like, now what am I going to do? You know,
Yeah.
so really recognizing that pattern and trying to get to a place of like enjoying where I'm at for a little bit, and just trying not to like just jump right into the next thing all the time. And I'm sure part of that probably comes from like, I don't know, childhood trauma or something, but
I mean,
I'm
doesn't
starting to
everything?
realize it. Yeah, I know, but I'm starting to recognize it in myself. Like, okay, you got to enjoy the process a lot more than what I have in the past.
Yeah. And I mean, I used to be, I mean, I guess I still am that way, kind of, but I feel like I'm a lot less um driven. I guess I don't want to say driven, but maybe that's the right word. But I'm not constantly like, even before I got my degree, I was thinking of what I was going to do next. Like I wanted to always one up myself. And it was like I was in competition with myself or something. And living that way is exhausting. And it probably didn't help. The experiences I've had with alcohol and stuff. I mean, that it's probably a factor with that because I was just trying to like chill out. And that was the only way at that time that I knew how to do that. But it's okay to be content and it's okay to just enjoy where you're at. And at least for me, like, I don't have to be the smartest person in the room. I don't have to be the prettiest one here. Like, it's okay to just be okay with who you are. And I don't know if that's something that comes with age or just experience or just getting sick of yourself or what, but it's nice to kind of get to that space where you just don't always have to be striving for the next thing.
Yeah, and I think it's funny too because I feel like it's been a couple weeks since those conferences, and I am feeling definitely better, but it was such a weird thing. Like I remember being on Marco and being like, "Sorry for being such a negative Nancy," because I felt like every time I showed up on there, I'm like, "I don't know what I'm gonna do next. Like I'm tired of this and that," and I recognize that like we still have so much work to do in our profession and blah blah blah. Like it's like, girl, chill.
Yeah, but it's nice to get that stuff out, because even with me, like if I'm on, by the way, for those listening, we're talking about an app called Marco Polo. It's like a video messaging app. And so we use it all the time. But even if I know that you're not going to listen to my message, sometimes it's nice to just get the shit out and then I feel better. And then the next day
Yeah.
you'll talk about it and I'm like, oh, I'm like over that now. It's fine.
Yeah, and it's honestly it's just part of life and being able to talk to each other on like a daily basis, you really see how everything comes in waves. Like there could be a time where like you're in a really, crappy situation and you're venting to me about it and I'm, having a good day but still able to like talk to you about it and then vice versa. Like I'm on the down and I'm like, "Girl, things suck right now." And, you're doing well. And so it's really just like a wave of life, honestly.
Yeah, and it definitely comes and goes. And that's the thing too with conferences is just to make sure like you remember like if you feel super good and like really high up here at a conference, just remember that's temporary. And usually what goes up comes down, right? So you're going to have a crash at some point. But then knowing in that crash, that's also temporary. Like things always level out and it's going to be okay. But something with conferences that I've learned over the last few years is really taking time to myself during the conference. So before I would try to go to courses, I would try to network, I would go to all the parties and the dinners and like literally everything wouldn't eat, would barely drink water. And then I would just not feel good. And so now it's like I'll disappear for a couple hours, and go up to my room and just chill out and decompress. And that's something that's really helped me, especially with these really intense conferences like RDH Under One Roof. What has helped you with those conferences, kind of just like chilling out?
Definitely rooming with someone who is like kind of the same frequency as you. And maybe like I always call it a night early. I'm not one to stay out and go to the parties just because I really want to get sleep. And I feel like too at the conferences, you really have to make sure to fuel yourself with food because if you start like if you go hours without food the next day like you're gonna crash and then a lot of times you might like come home and then you end up sick so definitely like making sure I'm eating good food and heading to bed early and also just like you said taking little breaks here and there and sneaking away and like going to your room for a little bit and then like coming back out and doing it again. You kind of need those little like micro breaks.
Oh, nice. Yeah, that's something that's really helped me too. Is just not trying to go like pedal to the metal like the entire time.
Hmm.
Something else that people don't like, maybe they don't realize the reality of it is being on social media and being a content creator. I feel like people might have a misconception of what it's like to be someone who's creating content, who's putting themselves out there. And I feel like what they think probably isn't the case. So when did you start creating content? Like seriously creating content?
So I say that I started seriously creating content October of 2020. So that was like when I got licensed and everything. And it was just still post still. I don't even think Reels and TikTok were even out yet. So that's when I started, the end of 2020.
And was it back then, was it mostly like dental related?
So my page actually was my personal page for a little bit, but I was not super active on it. And I eventually just was like, you know what, I want to make content about hygiene, and I just completely got rid of like all my like personal stuff that I had on there and just switched it completely over to dental hygiene content. And it wasn't like I post now where I'm posting every single day. It was maybe like a post or two a week or something.
Okay. And then just kind of like grew from there. Did
Yeah.
you, because I mean, last time I checked on Instagram, you were what, over 80,000 followers?
Yeah, a little bit over 80.
In TikTok, you're over 100K.
Uh-huh. Yeah.
So that's huge growth. I mean, me personally, I know how hard it is to grow on freaking social media. It does not happen overnight and it takes a lot of work. So that I feel like is very fast growth in a relatively short amount of time. So why do you think that is?
I feel like people's perspective might feel like it's fast, but I honestly have put in like so many hours worth of time that I mean it's been 4 years, but it's so much work. But what I will say I think has contributed to my growth is just being my authentic self and being relatable, talking about things that I don't see people talking about, maybe some of those harder topics. And I think also giving people recognition, if they're going to send me a message, then I'm going to take the time to write them back. And help them and be a resource. And I think that that has really contributed to my growth because when people reach out, I don't just ignore them. I try to help them because that's what I created my platform for.
Yeah, you've really, I feel like, done a great job at creating not just a page where you're just throwing shit out there at people, but you're like you have a community of people that support you, you support them, they support each other. I mean, yeah, we're gonna have negative people in there too. But I think that's why you have been so successful. And I just remember too, like I already said it a few years ago when I reached out to you, you helped me. I think I had a question about like what I should do on a video or something. And you just gave me your advice, like no questions asked, and were so helpful, and I know that you're still like that. But I think people maybe don't realize the work it takes to put into platforms. They're seeing maybe a 20-second video. They don't realize sometimes hours go into that video. And it's not easy to put yourself out there, especially when you're talking about what you say, when you're talking about things that maybe other people aren't talking about that are more controversial. I mean, it takes a lot of balls to put yourself out there? And people just, I don't think
Yeah.
they realize that.
Yeah, there is definitely a lot that comes with putting yourself on a platform. And you and I both talk about it a lot. I think that the negativity part of it isn't really thought about a lot when people look at people that are creating, because we share mostly the good stuff. That's just what we share a lot of. And there is that negative side to it too, and you really have to learn how to deal with all of that stuff at the same time. So it's a challenge. I mean, I'm not complaining. I love creating social media content. It's fun. I get a creative outlet. I get to do it while I'm at home and things like that. But there are some things that are tough with it too.
Like what's something that you wish people understood about someone in your position, like being a content creator?
Honestly, the number one thing I would want people to know is that I don't make as much money as you think I'm making. I mean,
Yeah,
part
true.
part like part of that is because I don't take as many deals as I could, but there's
Yeah.
a reason for that. But I just think that there's this perspective that maybe I'm making so much money and it is supplemental, and I have gotten it to a place where it has replaced one day of my clinical hygiene job. But I have taken 4 years of work to get to that place. And like before, like a year ago, maybe I wasn't getting paid for content. So I think that too, like you have to be willing to put in the work, be consistent, and show up for a lot of hours before you ever start to get paid well.
Yeah. And I know that's so true. When you said that, I was like, oh my God, that's so true. Um, because when I was new, I guess when I was new, I had that not about you, but about people who are creating content. Like, oh my God, I bet they're like millionaires, like swimming in money. Like, no, it's not like that. And I
Which
have
maybe some
people,
people are like,
well, yeah, maybe. I mean,
maybe.
I'm not, you know.
I'm not.
Yeah. But I've had people reach out, and they want to know how to start making money on social media. And I'm like, you need to create content every day for a good 2 or 3 years, like you can't go into it just wanting to make money. It's not going to work that way. And at least that has not been the case for me. And I know when I first started, that thought wasn't even in my mind. I just wanted to create content to help people with their freaking posture and their
Mhm.
ergonomics, and none of, yeah, as I'm all slouching. And none of that was paid. And then by the time I had people approaching me want to pay me, I was like, oh my God, like I need to figure this out. Like, and two, with you, I respect the way that you approach it, because you probably turn down 99.99% of opportunities that come your way. And I know that when you post something about a product, it's because you believe in it and you use it, and like you stand behind it, which just speaks volumes to me. And I feel like a lot of your followers probably feel the same way.
And I think as healthcare providers and licensed healthcare providers, like we have to remember that and not just put content out there for whatever product comes our way, because that's out there forever. And once you do that once, you can lose credibility so quickly. And so you do have to take it really seriously um, when you are partnering with another brand, or because not only are you putting your name on their brand, they're putting their brand name on you. So you just have to be really careful and just realize that you're a licensed provider putting content out on the internet.
Yeah. And it's like, if it's a product that you use, I mean, there's certain products every time I practice, I use, and I have no problem attaching my name to them, because I know the company, I know the product, it's fine. But if you're just like what you said, if you're taking every job that comes your way, people are going to see that. Companies are going to see that. And if say that you stand behind this like shitty instrument just because they're paying you, an actual good instrument company is going to see that and they're never going to want to work with you.
Yeah, like you kind of like could potentially lose out on deals in the future. And that goes to say with, free product, of course, there's a time and place for that to be acceptable. But once you accept free instruments and you go posting them all the time, once a month, whatever, you might say goodbye to any other instrument company that would potentially want to actually pay you for content in the future.
And you're setting a precedent with that company that you will do content for free. And the thing is, when companies are approaching us to talk about their product or whatever, they're not doing it for fun. They're doing it because they see our page, they see our following, they see the engagement, and that has value. And I think because some people don't, they don't put enough value in what they're offering. And I've told people, I can't even tell you how many times, like, if they're approaching you, it's for a reason. It's because they see value in you, and you have to see value in yourself too. Even charging them $50 for a post, I don't care, something. But do not set the precedent that you're going to do things for free, like in perpetuity, because then you're never going to be able to grow.
And that speaks for smaller creators too. Even if you have 1,000, 2,000 followers, it doesn't matter. You should still be getting paid, ideally something, like Beth said, $50, something for the content that you're putting out there, whether you're small or big, because your follower count isn't everything. And you could have a really small following, but have an audience that values and listens to you and will buy whatever you recommend. And that could be more of a return on investment than somebody who has a ton of following and gets no engagement and nobody cares what they are recommending.
Yeah, 100%. And for those listening, don't be fooled by follower count because it's very
Yeah,
easy
and
to buy followers and buy likes.
don't do
Um, like just don't.
don't do
But
it. It's
it's
obvious.
not easy to build a like sustainable long-term community, which is exactly what Britt's done, and it's something I'm trying to do too. You know, it's not
And
easy.
you've done it too.
Yeah, I'm getting there. Oh my God, but like starting over on YouTube is I can't even, it's humbling. And I just like humbling is a nice word for it. But I remember when I first started posting on social, my business coach was like, you need to post something like, I think she said once a week, maybe twice a week. And every time I posted something, it was literally like me and her liking it. That was it. And that's how I feel on YouTube. I'm like, I get 5 views and my boyfriend's one of them. So that's actually 4, you know? But
I
it's
know, and
like,
you have to like, sorry, you have to like relearn the whole process of how that platform works because they're all different and it's so hard.
I know, and I don't get it. And people on YouTube too, it's a different vibe and it's a different community and they don't mess around, you know? So it's like whatever I put on there, I really have to make sure, not that I put crap content out, but I just have to make sure it's really good to go on
Yeah.
YouTube. Yeah. So I guess like just to wrap up, like do you have any big plans coming up, like either fun plans or business wise or anything that you're excited about? I know you just got a new cat. I know that's exciting.
I know. I was hoping she would come out so I could show her. Definitely Jetta, my new cat, is my most favorite thing right now. Well, Julio's my favorite thing too. But she's my
Yeah,
newest favorite
good
thing.
save.
Um,
Yeah.
and I would say I'm really excited because I am going to another dental conference in September, and then also maybe somebody else's baby shower too that I'm excited about to attend. So that's pretty much what I have coming up most recently are those two things, baby shower and dental conference.
Well, I think that's awesome. And you've had so much going on lately. Like, I think it's good to maybe not have, 50 things that you've got on your docket.
Yeah, I
So my
agree.
last question for you is like, I guess it's two questions. What would you do differently as a hygienist and as a content creator if you knew then at the beginning what you know now?
As a hygienist, I always want to say that I wish I started it earlier, but I know that like timing is everything and
Hmm.
I'm where I'm supposed to be. And I know that I wouldn't be able to do what I've done now at the age of like, right out of high school and stuff like that. So I try to think of something else. Um, I think as a new hygienist, I didn't realize how much communication skills and like emotional intelligence matters. And I was always, and I am, willing to advocate. I want to speak up. I'm not afraid. And that's great. But like you have to learn how to do it in a professional way so that people can really listen to you and understand. And so when you get into an office, I think that's the thing I wish I would have learned sooner. I didn't realize how much communication skills matter in all aspects of our profession, in networking, in patient oral hygiene instructions, in our daily lives. Like communication skills matter so much. So that's definitely the thing I would wish I would have learned earlier on in my career because it took me a little bit to get there, and of course, still a work in progress on that. Um, as a content creator, I wish I probably would have what I would have done differently is try to recognize my value earlier on, because even now that's still something that sometimes I don't really realize, and I'm lucky to have friends like you and Amber and Anchi to remind me of my own worth because a lot of the times I don't recognize that in myself. And I think as an early content creator, I definitely had no idea what I was bringing to the table, and I'm still slowly starting to realize that. So I think just recognizing my value and having more self worth early on.
Yeah, I 100% agree with that. And it is really nice to have kind of a close circle of friends, especially female friends, that will remind you like gently that you're worth everything and more, as
Yeah.
far as the communication skills that you mentioned, that I mean, that's something that's so important, not just for hygiene, but for business too, or negotiating deals or trying to get a speaking engagement or whatever it is. And they don't necessarily teach that in school. So how have you learned? Have you read books on it? Is it kind of trial and error?
I think my frontal lobe just really developed. No, I was just kidding.
Like overnight, you're like, got it.
Yeah. No, I used to be very hot-headed and ready to explode and say something and respond right away. So definitely taking like the 24-hour rule where you think about something before you respond. I would say podcasts were definitely huge for me, and they still are. So listening to different podcasts just about like self-improvement was a big thing. Actually, not a big reader, so I didn't do a whole lot of reading. I would probably say the main thing that got me thinking about it was podcast. And then having mentors in the community that have a lot of experience. I've learned a lot from people that have all this experience and have passed down their knowledge to me.
Well, and you just being, because information is everywhere, but like you being open to that and being curious about how maybe you could do something different, whenever we're learning something new, it does take a lot of humility to realize you don't know everything. And like we all have room to improve, and that's fine. But podcasts too, it's not just the content that they're talking about, but it's how they're talking. And I pay attention to that too. I'm like, wow, like how is his cadence? How is he talking? How is he keeping me interested? How is he interviewing his guests? So there's a lot to learn there too.
Yeah, it's been a journey, and I feel like it's definitely something that I will continue to grow on, especially with networking in dentistry. I mean, you learn so many different things with that, and I never realized that there's like a technique to like having a conversation with somebody. And it's little things. It's not like anything that makes the conversation like weird. It's just being more aware of like the conversation and like body language and different personality types and just paying a little bit attention to that kind of stuff. And I think it ultimately makes you be a better clinician too when you can really sit there and um, connect with your patients.
And a lot of it's just slowing down. And that's something that's like hard for me. But yeah, if you're networking, I mean, don't just shove your business card in their face in the first 2 seconds, it's just like slowing down with patience. It's slowing down and listening to them. Yeah, so thanks for that. So how can people find you? I mean, I'm sure most of the people listening to this already know you, but we'll just say it for fun.
So mostly I respond to my DMs the most on Instagram. So Brush with Britt on Instagram, Brush with Britt, TikTok, YouTube, Facebook. And then if you want to email me, you can email me at brushwithbritt@gmail.com. I guess I
Awesome.
should say it's Britt with two T's,
Oh, yeah,
just
that
in
helps.
case.
I mean, just Google brush with Brit and she'll come up. It's fine.
That too.
Thank you so much for joining me today and spending some of your Saturday here. And I've told you this in private and I'll say it in public. I just admire how quickly you have established such a role in our industry in a short amount of time. And it's just really inspiring, especially for new hygienists and seasoned hygienists like me to realize the impact that you can have. So I'm blown away by what you've done.
Thanks, Steph. And always ditto. The same girl. I love you.
I love you too. All right. Thanks for listening.